What is the best way to discuss colonoscopy with older relatives? Talking about colonoscopy with older relatives can feel delicate, but it's an important step in supporting their colon health and reducing the risk of colorectal cancer. As people age, their chance of developing colorectal cancer increases, making screening more relevant. However, the decision to undergo a colonoscopy depends on individual health, life expectancy, and personal preferences. The key is to approach the conversation with kindness, clarity, and respect for their autonomy. Start by explaining what a colonoscopy is in simple terms. It is a procedure where a doctor uses a flexible tube with a camera to look inside the colon and rectum. This helps find polyps, which are growths that can sometimes turn into cancer if left untreated. Removing these polyps early can prevent cancer from developing. For most people, screening usually begins at age 45, but for older adults, the decision to continue depends on their overall health and how long they are expected to live. When talking about this with your relative, focus on their personal health and how long they might benefit from screening. For example, if they have serious health issues or a limited life expectancy, the risks of the procedure might outweigh the benefits. Generally, screening is not recommended for those over age 85, and for those between 76 and 85. It's best to discuss with their doctor whether continuing screening makes sense based on their health history and prior screenings. It's also important to discuss the risks and benefits honestly. Colonoscopies are generally safe, but they can carry risks like bleeding, perforation of the colon, or complications from bowel preparation. The prep can be uncomfortable, especially for those with mobility issues or other health conditions. On the other hand, the benefits include detecting and removing polyps early, which can prevent cancer, and catching any issues early when they are easier to treat. If your relative has had regular colonoscopies in the past with no significant findings, they might not need to continue screening as often. But if there is a history of polyps or colorectal cancer, or if they have not been screened regularly, their doctor might recommend ongoing surveillance. Encourage your relative to have an open conversation with their healthcare provider. It's important they share their concerns, values, and what matters most to them. This shared decision-making helps ensure the choice aligns with their health goals and personal preferences. Use clear, simple language and avoid alarming terms. Focus on facts and explain that the decision is personal and should be made with their doctor's guidance. Offering practical support can also make a difference. You might help with scheduling the appointment, assist with the bowel prep, or accompany them to the clinic. This support can make the process less stressful and more manageable. Remember, the goal is to have an honest, respectful conversation that considers their health, wishes, and life circumstances. Emphasize that screening can be a valuable tool for maintaining colon health and preventing cancer, but it's ultimately their choice. Encourage them to speak openly with their healthcare provider to make the decision that's best for them, based on accurate information and their individual situation.